Welcome to my channel Brainies. In today's video, I'm going to talk about the 4-score scale. The 4-score scale is a valuable tool which is used to assess the consciousness in patients with neurological conditions. It provides a versatile assessment which is as similarly compared to that of the Glasgow Coma scale. It was first initially developed by Dr. Ilko F. M. Wejcik and colleagues in neurocritical care at the Mayo Clinic in Rochester, Minnesota. This 4-score scale, which is abbreviated as Full Outline of Unresponsiveness, it's a neurological scale which is used to assess the patient's level of consciousness, particularly in patients suspected with brain injury or in intensive care. So it can be replaceably used for Glasgow Coma scale, and it focuses on the eye response, motor response, brainstem reflexes, and respiration. Each component is being scored from 0 to 4 with a total score ranging from 0 to 16. So the highest score indicates the higher level of consciousness. So the 4-score scales, the components are the eye response, that is, it assesses the patient's ability to open their eyes, track the objects, or blink to the command. The next one is the motor response, which evaluates the patient's ability to move their limbs in response to any command or pain. The brainstem reflexes, it examines the reflexes like pupillary reflex, corneal reflex, and cough reflexes to assess the brainstem function. The next component is the respiration, which assesses the patient's breathing pattern, including whether they are intubated and the respiratory rate. So what are the main advantages of this 4-score? It's comprehensive. It provides a detailed assessment of the neurological function than when compared to that of the GCS, particularly regarding the brainstem reflexes and respiratory reflexes. And the next one is the applicable to various patients. So it can be used to intubated patients and those with neurological deficits, unlike in case of GCS, which relies only on the verbal response. So the prognostic value of this 4-score is, studies have shown that this can be a good predictor of patients' outcomes, including the mortality and the functional recovery. So these are the components of the 4-score scale. So the first one is the eye response. So it is ranging from 0 to 4. So first response is the eye response, where the response 4 indicates the eyelids can be open and tracking, or the patients will blink to the command. Number 3 is eyelids open but not tracking. And number 2 is eyelids closed but open to loud voice. And when the therapist gives a loud voice, the patient responds. And number 1, the eyelids close but opens only to pain. And the last 0 is eyelids remain closed with pain. So coming back to the motor response number 4 is thumbs up, fist or peace sign. Number 3 is localizing to pain. And number 2 is the flexion response to pain. And number 1 is extension response to pain. 0 is no response to pain or generalized myoclonus status. There will be nil response. And coming back to the brainstem reflexes, number 4 indicates the pupillary and corneal reflex will be present. And number 3, one pupil will be wide and fixed. Number 2 will be pupillary and corneal reflexes will be absent. And number 1 will be, again it remains the same, and 0 will be like absent all the reflexes, pupillary, corneal and cough reflexes. Coming back to the respiration, number 4 indicates the patient will not be intubated and regular breathing pattern will be there. And number 3 indicates not intubated, chain strokes breathing pattern. And number 2, not intubated, but the breathing will not be regular, it will be irregular breathing pattern. And number 1 will be breaths above the ventilator rate. And the last 0 indicates breaths at the ventilator rate or apnea. So the 4-score scale is actually a 17-point scale. Actually speaking, 4 components, 4 each, so totally 16, but inclusive of 0, it indicates 17-point scale. So with the potential scores of ranging from 0 to 16. Decrease in the level of the 4-score is associated with a worsening level of consciousness. So higher the scores will indicate the higher level of consciousness. Lower the scores indicates the lower level of consciousness. That's it with today's video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.